It is make or break month for health care, and President Obama now under fire from members of his own party. Democrats forming their own angry chorus, furious at the White House for dialing back its commitment to the so-called public option. They are crying betrayal and vowing to fight back. So our big question tonight, is it all or nothing when it comes to health care reform? And one of those who wants to keep the public option is Democratic Congresswoman Maxine Waters, who's a member of the Congressional Progressive Caucus. She's joining us tonight from Los Angeles. In Washington, Ezra Klein, who is staff reporter for the Washington Post, and he is keeping a blog that focuses largely on health care policy. And here with me in New York, our senior political analyst, Jeffrey Toobin, joining us as well. Welcome to everybody. Congresswoman, let me start with you on this. You yes. said that you won't vote for a bill without the public option. Why is this a deal breaker for you?
It's a deal breaker because the whole idea behind health care reform is to bring down the cost. We cannot bring down the cost unless there's a public option that will create competition. We cannot turn this over to the same people who have been, making the cost of health care just go off the scale. The premiums continue to go up, they continue to make more money, and the CEOs continue to make big salaries. We've got to stop that. The only way to stop it is with a public option.
Well, Congresswoman, President Clinton, who knows quite a lot about what it's like to fight for health care and fail, has been warning liberals, not to let the perfect be the enemy of the good here. And let me just play you a little bit of what he said. This is to a group of liberal bloggers this weekend. Listen.
It is politically imperative for the Democrats to pass a health care bill now, because one thing we know and that I've lived through is that if you get out there and then you don't prevail, the victors get to rewrite history. And I want us to be mindful that sometimes we may have to take less than a full loaf.
So what do you think about that? Sometimes we may have to take less than a full loaf. Are you not prepared to make any compromise?
Listen, no, let me tell you, I'm one who supported a single-payer plan. Most of us progressives did support a single-payer plan. They asked us not to push on that was going to be impossible to do. This would cause a lot of confrontation. We backed up on single-payer and decided that we would go with public option that was supported by the President of the United States, and we consider that we've made a huge compromise. And so it's not that we want the perfect, we want what is credible. You cannot have credible health care reform if you don't address the issue of the rising costs. And this is not just about the uninsured, this is about working people who every day go to work, and increasingly they're paying a larger percentage of their income for health care than in recent years.
Let me have Jeff back it up a little bit and just explain to people what we're talking about when we talk about the public option. What does that mean to people at home?
People sometimes talk about these things in shorthand, in code. In simple terms, a public option is, we all know what insurance companies are. Most of us have our insurance through Aetna, United Healthcare, Oxford, whatever. The idea behind this plan is that there would be a different plan, Uncle Sam's plan, run by the government, where you could get insurance through the government. And conservatives say, well, that's unfair to the existing companies because they would undercut, drive them out of business. Like Congressman Waters say, supporters of the plan say, look, it's just good competition and there's no reason why it would be unfair. Look how well UPS and FedEx do competing against the post office. That's
the point
the plan.
that the president has made time and time again.
Many people.
Ezra, let me go to this. You heard Congresswoman Waters there. Give us a sense for how intense the anger is on the left over this, and are they willing to really put muscle behind it?
It's very significant, right? I mean, I think that for the left and for that matter for the right, the public option has become the single symbolic measure of success on this, right? I mean, it's a big bill, the parts are hard to follow, and it's hard to say whether you're winning or you're losing, but this has become the way people decide that. Now, as for the muscle piece of things, I mean, it's going to be a tricky fight. The Congresswoman and the Progressive Caucus have made an argument that if you try to sacrifice the public option for a couple votes in the Senate, you're going to lose so many in the House you can't pass the bill. At the end of the day, they're having trouble prosecuting that because people think that they're not really going to kill health care reform. But I've spoken with the chairwoman of the caucus, and they seem very serious about it to me.
But address that argument, if you would, Congresswoman, that I guess bottom line is they think you're bluffing.
Well, let me just say that this is a dynamic process. And for those of us who feel strongly about having a public option, having a credible health care reform bill, not caving in so much that what you get won't amount to real reform, we're serious. I'm told that someone said, oh, you don't have to worry about the progressives. We'll eventually get them. I don't think that is the case this time. I think that we have a lot of people who feel very strongly about this. We're going to hold firm, and we're going to demand that we have a credible health care bill. No one can say that we're not willing to compromise at any time, any place, anywhere. We did that on single payer. We showed that we were willing to work with the blue dogs and the opposite side of the aisle and anybody else who didn't like single payer. So we backed up, and now we are insisting on having a public option, and I think that's where we're going to stick.
All right, Congresswoman Waters, Maxine Waters joining us tonight, Ezra Klein, and Jeff Toobin, who's going to be sticking around to talk to us again a little later.